Hi everyone, I'm Nicola Dalbeth from Auckland, New Zealand, talking about some more gout abstracts from the ACR 2020 meeting. I was really interested in a couple of abstracts today related to comorbidities in gout. So the first is abstract 1466, which describes multimorbidity in various rheumatic diseases, including rheumatoid arthritis, osteoarthritis, psoriatic arthritis, and gout. So this is a study from the RISE registry, so a rheumatology clinic-based registry, really assessing the burden of multimorbidity in various rheumatic diseases. In this study, people with gout within rheumatology clinics had the highest rates of multimorbidity. And not surprisingly, I think, the most common comorbidities observed were metabolic and cardiac risk categories. So I think this certainly gels with what we see in the rheumatology clinic. Often patients with comorbidities such as severe heart failure, kidney disease are more likely to come to our clinics because management of gout is more complex. I think this really does raise quite a lot of challenges for us in rheumatology clinics. And I think given that we have a lot of focus at the moment on the role of comorbidities in outcomes related to COVID, I think that this is a particularly important area for people with gout. And we haven't really seen a lot of data on outcomes for people with gout related to COVID-19 infection. The other thing that's been really important this year has been within the medical literature has been a number of clinical trials reporting outcomes of common gout medications for other comorbidities. So I'm particularly thinking about a couple of allopurinol trials, the PEARL trial and also CKD-FIX trial, which tested the role of allopurinol for prevention of CKD progression, both of which were negative. And also the Colcott studies and LODO-CO2 study, which reported improved cardiovascular outcomes in people treated with colchicine. Now, in both the allopurinol studies and also the colchicine studies, this didn't specifically include people with gout. But I think certainly this again raises the possibility that some of the medications that we use for gout, particularly medicines like colchicine, may also have some benefits for comorbidities such as cardiovascular disease. The issue around kidney disease with allopurinol, I think, is probably less clear, and in fact, there may not be benefit. Related to this, there's also been a really interesting abstract 0660, which reports on the risk of gout with SGLT2 inhibitors. So of course, these are drugs that are used increasingly for people with type 2 diabetes, and a number of studies have reported that SGLT2 inhibitors are urate lowering and can also prevent the risk of gout. And this is a very interesting abstract because it suggests that some of the SGLT2 inhibitors may have a preferential effect on gout risk using the THIN registry. So I think that these are important abstracts. They really highlight the importance of thinking about comorbidities for people with gout in our clinics, and also suggest that some therapies that we use for treatment of gout may have benefits for comorbidities, and also vice versa. Some medications used for comorbidities may be useful for prevention of gout as well. Thanks.